Hola, ¿qué tal amigos? Bienvenidos una vez más a un podcast de Neurociencia para vivir mejor. Hoy me complace mucho presentarles a nuestra invitada, que es la doctora Zakreski, quien es investigadora de ciencia básica en neurociencia y cognición en el National Institute of Mental Health de República Checa y que le da un enfoque a la investigación con la exploración de respuestas endócrinas en el estrés y la adversidad en la infancia temprana, y cómo la historia de vida de las personas participa en la formación de vínculos afectivos y cómo eso nos lleva a la adultez a tener ciertas expectativas de cómo debemos de comportarnos. Y en particular nos va a hablar de un estudio muy reciente que tiene de cómo las personas llegan a tener creencias de lo que significa hacer o no hacer, eh, desde el punto de vista legal o no legal, lastimar a otros desde el punto de vista de conductas sexuales y cómo esto repercute en interacciones del individuo con la sociedad. La doctora Zakreski hizo su doctorado en neurociencias en la Universidad McGill de Montreal y me da muchísimo gusto recibirla este día. Thank you very much, Alain, for participating in this podcast.
Thank you so much for having me.
Just for making an introduction, Alain is in Czech Republic, which is 8 hours difference from Mexico. So we're having this nice conversation real time, thanks to technology that is having us apart this long distance. It's fantastic. Well, Alain, I would like to start with this question for you. Now that you're doing your research in Czech Republic, but you did your PhD in Canada, how is your experience doing science in North America, like Canada, and then moving to Czech Republic, about the openness of the government and the culture to do sex research?
I actually didn't do so much sex research when I was in Canada. I primarily focused on stress, particularly childhood adversity, and how that affects the entire organism, including aspects of their sexual behavior. But I really started my focus on sex research in the Czech Republic, and I found that this is a very easy place to work in general. People are very open. My colleagues have a similar experience. People appreciate the importance of sex research. It isn't just about reproduction and erectile dysfunction. It's seen as a component of human well-being, which I think is really terrific. I also think that they have a very progressive attitude towards paraphilia and pedophilia, and the people I work with really see individuals with these abnormal sexual interests as human beings, not just potential criminals. So I'm very happy to work here. It's an excellent environment for scientific research.
Nice. It's very nice to hear, because sometimes I was asking another professor who I interview many podcasts away, what is your opinion about the difference in sex research between different countries that you have visited? And he was telling me, sex is the same regardless of where you are. Just what changes is pretty much the inhibition or the restrictions that society and culture puts in certain topics. And the topics that you are exploring are particularly intense and maybe some sensitive for certain people, like paraphilias, perhaps, because normally in the more religious is a culture, the more fixed are the beliefs. And beliefs and the cognitions, as you call it, are something that influence very much in the way we think and the way we react towards novelty and towards something that directs our behavior. But that's a topic that I want to ask you a bit later, because it was very interesting reading your recent paper.
Thank you.
Pretty much what I was reading in your CV is that you're interested in stress during infancy or early infancy,
Childhood,
and how it might affect the development of pair bonds or attachments during the first infancy and adulthood. And then when I was reading that, it came to my mind somehow the experiments of Harry Harlow from many decades ago, where he puts, I want to put the audience a bit in context, when he put some monkeys isolated from the mothers during several months, and then he introduces monkeys to the normal colony, and he sees all these abnormal social behaviors in these monkeys. This takes me to the questions. What is the way you see adversity in childhood as either negative or positive, considering that in the current society, at least it appears to me, that many young people don't know or didn't develop the capacity to deal with adversity. And then that's what we are watching in their society, like frustration, incapacity to keep a job during a long time, incapacity to maintain social and romantic relationships. But at the same time, you're saying that adversity during childhood can have the opposite effect as well. What can you tell us about that?
I think that's a very important question. One of the researchers that had a really significant impact on me is a researcher by the name of Bruce Ellis and his colleague Marco Del Giudice. And they talk about how we have this tendency as researchers and perhaps as even a society to fixate on how adversity harms people. We see the consequences of adversity, its effects on our behavior, on our development as pathological. But we have to take into consideration that throughout the history of our species, human beings have dealt with adversity throughout their lifespan, different kinds of adversity. So this idea that humans are not evolved or equipped to respond to adversity is probably incorrect. But these researchers, Bruce Ellis and Marco Del Giudice, talk about how humans likely evolved to respond to adversity by switching aspects of their behavior and physiology so that it is adaptive in harsh conditions. So I think a really interesting example of this is that even in rodents, we know that early life stress impairs performance on certain memory tasks. It impairs performance on certain cognitive tasks. However, if you take those same rats and put them in a stressful condition, their cognitive performance is actually better than normal. So I think that adversity actually prepares us to live and deal with harsh conditions, but some of those effects, some of those adaptive effects look pathological. So for instance, when we see a child who has been abused act aggressively, we think that this is pathological, and we don't consider how aggressive behavior or being mistrustful of others might actually be adaptive in harsh conditions. Does that make sense?
Yes, totally. That's very interesting, because somehow here in Mexico, we have a saying that nobody gets out of childhood without a problem-free. You know, eventually everybody is dragging something from childhood that is making you modify your behavior or your mentality to adapt to the conditions that you think that's the way it is life. And sometimes we see people that is overstressed, overthinking, perfectionist, etc., that in reality might represent adaptations that something happened in childhood. But here my question is, to what extent psychiatrists or mental health people draw the line between what is a normal adaptive response and what is beyond and is falling into the pathological categorization? How do you see that?
Well, it's difficult to answer that question because I'm not a clinician. But I think that researchers and clinicians who are trying to solve problems for people that have experienced adversity probably are biased towards considering the effects of adversity as pathological. And I think it's really important to consider how those effects could actually be adaptive. And I think one of the reasons it's important to do that, especially if you are treating a patient, it gives them a sense of hope. So if you tell them that, oh, well, you're broken because of your experiences, your body doesn't work properly, your brain doesn't work properly, I imagine that that doesn't exactly instill a positive outlook. But if you focus on how adversity might have affected them in an adaptive way, they're not necessarily broken, their brains and their body are behaving in an adaptive way. Perhaps that gives patients a sense of hope. It maybe motivates them more.
Right.
So I think this is a good approach both for research and for people treating individuals with adversity.
Right. As far as I know, I've seen that the DSM also categorizes pathological or not, depending on how much stress the person experiences, right? If it doesn't affect his or her mental health, having distress, etc., it might not be considered as pathological, as if makes him or her dysfunctional. But in addition, to the extent that may or may not hurt others that are around this person. I guess like hurting or not hurting yourself or others might be another way to see it.
Yeah, or if it interferes with your ability to function. So I think you have to consider the relationship between a person and their environment. So maybe this person has become adapted to harsh conditions, but it makes them difficult to function in safe, supportive environments as well. So you have to consider the match or the mismatch between the person and their environment.
Right. Somehow your research is fascinating to me because it says that not only the genetic and biological aspects of behavior matter in what is going to happen in the future, but also what you're saying is that beliefs or cognitions that develop during childhood, that is part of culture and psychological associations, somehow is the seed that becomes revealed or expresses the behavior in the adult. And it's not only how this person became genetically or biologically predisposed, but also nurture having an effect in the person. And in that regard, it makes a lot of sense to me because I'm repeatedly saying that we individuals are a combination of biology, psychology, and culture. And in that regard, one of them is leading the others, but the three of them make who we are and participates in the plasticity that finally in your brain eventually is going to be expressed. My question in that regard is, according to what you observed in your recent paper that is in Archives of Sexual Behavior, by the way, very recommended to readers, what are the factors in childhood that most significantly contribute to the development of these adverse offensive behaviors in adulthood?
That's a really great question. And I think the answer is very complicated. And I think there are multiple routes by which adverse childhood experiences could lead to sexual offending. First, I just want to emphasize that whether a person sexually offends depends on so many different factors. It requires motivation, it requires opportunity, it requires a breakdown of things that would normally inhibit that individual for offending. And I think that childhood adversity can contribute to all of those in some form or another. My research focused on how adverse childhood experiences could lead to certain cognitions that can increase the likelihood that a person sexually offends. A person might be more likely to sexually offend if they possess something called offense supportive cognitions. They used to be called cognitive distortions, but we now use the term offense supportive cognitions. And by that, I mean they have beliefs or attitudes or ways of thinking that justify, excuse, minimize, or rationalize sexual offending against a child or an adult. So a classic example is victim blaming, or believing that the offender had no control over the behavior, or what is typical among minor attracted individuals is believing that the child benefited from the abuse because the adult is teaching the child about sexuality. So there's many different types of these cognitions, and they can increase the likelihood that an individual sexually offends.
Right.
So where do these cognitions come from? They can come from different sources. So, for example, individuals can form these cognitions as a result of sexual offending so that they don't feel guilty. They can form these cognitions before they offend to reduce barriers so they don't feel bad about doing something that they want to do. Or these cognitions can form long before an individual offends as a result of childhood experiences. And that's what my research focused on, my colleagues and I. And we found that individuals with a history of childhood sexual abuse had higher levels of cognitions supporting rape or child molestation.
But the three explanations that you give make me think of different psychological explanations as well. For example, the first one make me think of Pavlovian associations. You do receive and you develop associative learning in that regard, in which contingency and contiguity occur very shortly. I would think that what is mainly increased in that sense is desire for repeating again what happened. I don't know, that's what I'm thinking. Whereas in the last example that you mentioned, contingency, I don't know if it's that long from infancy to adulthood, and implies many more memory, long-term memory, and associations that imply many more cognitive work to bring back all memories and kind of revive, to sensitize again what happened many years ago to justify what I'm going to do now. So what is your opinion about
that? Tony Ward has published a lot of papers on this topic, and he's a very interesting researcher. And he talks about how individuals who have these adverse childhood experiences, they don't necessarily form offense supportive cognitions right away, but instead they form these very general sort of implicit theories or implicit beliefs about how the world works. So if you are exposed to childhood abuse, you might learn that, adults are untrustworthy, or the world is hostile, which in turn might lead to more offense-relevant beliefs. So if you believe that adults are untrustworthy or hostile, you might think that, children are trustworthy. Children are therefore a better source of love and acceptance than an adult. So Tony Ward's idea is that childhood adversity has a major sort of global impact on how the individual sees the world and themselves. And from this sort of way of seeing the world, they then form offense supportive cognitions.
Now I'm wondering if childhood adversity that eventually develops offensive behavior in adults has to do or must be directly related with sexual molestation or a sexual topic in general, or if other types of adversity in childhood can be translated later in future, so the adult now redirects their not dealing well with the adversity in childhood, but in a way of sexual molestation.
Yes, that's a very good point. My research, or the research of myself and my colleagues, we found that childhood sexual abuse, but not emotional neglect, was associated with these cognitions. However, I don't think it necessarily has to be sexual abuse. I do think that any form of childhood adversity could play a role in the formation of these cognitions. It's just you have to look at how specific forms of adversity lead to specific cognitions. So, for instance, we did not examine whether emotional neglect has an effect on specific types of cognition, which would be an excellent topic for future research. So I definitely believe that other forms of adversity could lead to offense-supportive cognitions. However, our research suggested that childhood sexual abuse may be particularly important. And I think it ties very nicely with qualitative research that has been done on pedophiles or men with pedophilia that have sexually offended. Researchers ask them, like, why did you offend? Many of them say that, oh, well, I learned that sexual abuse was okay because it was done to me when I was a child.
Right.
So I think that sexual abuse can really facilitate these cognitions. And there could be various reasons for that. For instance, maybe the individual develops this idea that, oh, child molestation is okay. Child molestation doesn't really harm children. Child molestation doesn't mean that my father or my caregiver doesn't love me. They may form these beliefs that trivialize child molestation because it helps them make sense of or cope with their own history of abuse.
Now you make me think of other research in Canada that is going on. Like, comes to my mind, Dr. Nafisa Ismail, who is exploring the effects of stress during puberty and other critical periods of development, and how all the immune response and neuroendocrine response that is somehow altered by high stressful situations might have an enduring effect in the adult, in the behavior, in their anxiety and depression and sexual behavior. And it makes me think, if this kind of research like the one you do, eventually in few years, we're going to have some data indicating that what happened during COVID-19, in which there was many pregnant women with immune responses during the infections, might have something to do with motivated behavior in the adults during that time.
Yes, I think that adversity has really interesting effects on sexuality. And I think that the immune system, along with other components of your physiological stress response system, play a really important role in mediating the effects of adversity on sexual behavior. So, for instance, we know that early life adversity and perhaps adversity at other parts in the lifespan basically accelerate or intensify people's reproductive efforts. So, for instance, children who are maltreated, they go through puberty earlier. They have sex at a younger age. They give birth at a younger age. They tend to have more offspring. They tend to have more sexual partners. So it seems that adversity kind of accelerates reproductive effort or mating. And there's an interesting evolutionary explanation for that that's based on a theory called life history theory. And it argues that if you live in an environment that is harsh, where there is a high likelihood that you will die at a young age, the adaptive thing to do is to have as many babies as possible as soon as you can, because it will increase the likelihood that you'll leave a descendant behind before you die. Increase in reproductive effort, this acceleration of sexual development could be an adaptive response to adversity, which increases the likelihood that a person will produce children and thus pass on their genes.
Nice. You make me think of somehow like people with adversity in childhood, somehow the brain is giving signals of life might be short. You better speed up and do
Exactly.
you better do everything before you die, right?
Exactly. You even see accelerated development of certain parts of the brain. So for instance, you see accelerated development of the amygdala, accelerated development of the hippocampus in individuals exposed to early life adversity. And it's the explanation for that is just how you put it. You better speed up, you better prepare for a harsh environment, you better do all the things an organism needs to do before you die prematurely.
And somehow we see it in many cultures that children who have to be mature before they have to, because something happened, somehow they are forced to be what they're not ready yet to be, with the consequences sometimes positive, for instance, developing more adult-like behaviors, but with a cost in their mental health, being probably more anxious and more depressive and more with a bigger tendency to develop other discomforts, you know?
No, absolutely. There was a developmental researcher, I can't remember the name of, but he talked about how you should resist anyone that tells you to grow up faster. It's better to grow up slower than faster. And we see examples of that on different levels. So like you said, we see increased rates of depression, but individuals that go through puberty earlier, they are more susceptible to certain types of cancer. Children that have sex at an earlier age are more likely to have risky sex, like unprotected sex, sex while intoxicated. So there are definitely costs of growing up too fast.
Right. Just let me see if I understand so far well, Ellen, which I'm fascinated, by the way, with your research. So what you said is that child molestation and sexual assaults during infancy are the main predictors of offensive supportive behavior in adulthood, but not necessarily emotional neglect behavior in childhood. Is that correct?
Yes, but I would also add that besides childhood adversity, there are other factors that contribute to offense supportive cognition. So, for example, people might form these beliefs right after they offend so that they don't feel guilty, or they might form these beliefs right before they offend to make it easier for them to do something that's bad that they want to do.
Very interesting, because that opens up many more lines of research of how the associations can occur independently of the contiguity or contingency between the events. I mean, it's not direct short period association, but can take many more sequels. Still, I have many more questions for you, but this interview is getting better and better. So I'm going to try to make them all if possible. So first, I would like to ask if psychologists or people in research as you can know so far what are the early indicators in childhood that these individuals might eventually, when they grow up, have these offensive supportive beliefs. And the additional questions, what are the indicators? And when parents detect those indicators, and I'm thinking, for instance, in hurting animals, no? For instance. But
yes.
Once you detect those indicators, what is the appropriate approach from parents to start making an effect, an early positive effect for that not to happen?
The answer to that question is really important, and I don't know it, especially the best way to respond. However, I do think there are some important indicators. So I think there is a pathway we have to consider that individuals follow when they go from childhood abuse and neglect to offense supportive cognitions. And I think an important step on that path is intimacy deficits. So a lot of people have emphasized relationship problems and intimacy deficits as an important component in the development of sexual offending and potentially abnormal sexual preferences. So the idea is that you are deprived of healthy experiences of intimacy. You form an insecure attachment style. So that means you have difficulty trusting others. You might view yourself as unworthy of love. And that leads to more negative intimacy experiences. You fail to have positive relationships with a romantic partner or with even a peer. And I think that this can lead to hostility. This can prevent the development of empathy. And I think all of this would certainly reinforce offense supportive cognitions. Does that make sense?
Yes, perfect. So now I'm wondering, according to the some theories of people with pedophilia or child molestators, most of the research focus on the frontal lobe as the main brain area in charge of controlling empathy, decision making, theory of mind, and pretty much trying not to hurt the other ones. But your research suggests that there are somehow, I'm going to call it epigenetic effects of child adversity that eventually are going to modify functions of biological mechanisms. And when the adult is expressing their behaviors, is something that happened because of nurture. But in reality, many other things, biological and epigenetic, also occur. What would be your link between these events and the theory of prefrontal cortex as probably the main regulator of moral behavior?
Individuals with pedophilia do show a number of structural differences in their brain. They have reduced white matter connections. So they have a lower white matter in the arcuate fasciculus, for instance. So they show these white matter reductions, which means that parts of their brain have difficulty communicating. Those connections, so for instance, the arcuate fasciculus, are important for language processing and social behavior. And I do believe that a major component of minor attraction or attraction to children is that you have poor social skills. You have difficulty achieving intimate relationships with adults that makes you more commensurate with children. You find children less threatening. And indeed, we see that many people with pedophilia, they tend to have neurodevelopmental disorders. They have low IQs. Mm-hmm. So I think a lot of the alterations in their brain reflect sort of just lack of intelligence, difficulty getting along with adults, which makes them more attracted to minors. And I think in terms of how it would impact cognition, if you have changes in your brain that make it difficult for you to be cognitively flexible,
right,
that make it difficult for you to have insight, I think that those alterations could lead to these cognitions becoming sort of permanent and inflexible.
Right. So we know that the best prevention for child abuse is being a good parent, taking care of your own children, and not giving them to the neighbor to take care of them. Sometimes neighbors are awesome, but sometimes people don't even know who the neighbors are. And also we know is that sometimes molestation or abuse comes from people very close to the family, not
Yes.
necessarily unknown people, you know. Knowing all that, what would be your advice to parents who are listening to this podcast to prevent, for instance, first time, to prevent all these initial consequences when the childs are still young?
Yeah, so you're absolutely right in that many cases of child molestation involve someone that's close to the child, even a relative, even a cousin, a sibling. Also, what I said is true about many pedophiles having low intelligence. This doesn't apply to all of them, and a lot of people with pedophilia, if they're not getting treatment, will seek out jobs or opportunities where they can be close to children. For instance, they might become camp counselors or teachers, and often they're able to interact with children and even behave inappropriately towards them just because the parent doesn't think to suspect them. I think it's really important to think about who's in your child's life. In terms of compensating for child abuse, I know that grandparents actually play a really important role in compensating for poor parenting. Of course, there are many reasons why parents are abusive or not nurturing. Often they have to do with stress or mental illness, which in turn is affected by social support. So if parents are depressed or overwhelmed, it's important to realize how their mental health impacts their parenting and to seek support from grandparents and other members of communities. Like, it's not realistic to expect a person to raise their children without outside help.
Yeah, something that I think is important, and I would like to tell the audience about that, is that you don't have to be the parent of a child to make a big influence, positive influence on them. Sometimes it's the martial arts coach who becomes the important figure, the paternal figure, where they find comfort. Sometimes it's the teacher at school who finds support and the opportunity to heal things that they are dragging from the past. Sometimes it's friends, other people. And what I want to say is that we all have the opportunity to be, I'm going to call it curative therapists, non-professional therapists, in helping others to heal wounds from the past. So that gives us an opportunity to contribute as society to heal other people from the society.
Yes. And I also wanted to emphasize, and I think this is becoming a really relevant problem, especially in the US, how important it is to educate children about boundaries, especially sexual boundaries. So I think one of the major disadvantages of depriving children education about sexuality, which includes education about how your body works and your right to have boundaries.
Right.
We don't allow that because we don't want children to hear about sex. Then how is a child supposed to react to somebody who touches them inappropriately? Children need to be told that they have boundaries, that no one else has a right to cross those boundaries, and children need to be told what to do if someone does.
Right.
So sex education, which includes an education about consent and boundaries, is critical for children.
Right. Now, Elena, I want to ask you the most difficult question for the very end. Do you think offensive behavior is reversible?
Do I think that the effects of adversity can be reversed?
No, that of people who actually express offensive behavior. Do you think they have possibilities for reversal? to non-offensive behavior?
Yes, I do.
Okay.
I think it's very sad that society treats sex offenders, well, we should call them individuals who commit sex offenses, because firstly, most sex offenders, most people who are convicted of sexual offending, offend once. They don't offend all the time. It isn't an inherent part of who they are as a person.
Right.
Secondly, many individuals that have pedophilia, many individuals that sexually offend are disgusted by their behavior, and they very much want to change. They don't want to harm children, and that requires therapy, that requires social support, that requires destigmatization.
Perfect. Well, Ellen, your research is fascinating. I'm really looking forward to having you and the other speakers here in the mini symposium in Mexico. Just for the audience to know, Ellen is one of the star speakers for the symposium. We're going to be delighted to have you here with your presentation about all this topic in more detail. And many students are going to be looking forward to having conversations with you and the other speakers. Ellen?
I'm so excited. I'm very excited to attend.
Wow, it's going to be your first time in Mexico, I guess. It's fascinating. You're going to love it. Especially food and people is the most important in Mexico.
Definitely.
Thank you very much, Alan, for your time and your sharing your knowledge with the audience and with me. We appreciate it very much, and thank you so much. I hope you have a not that hot weather in Czech Republic, because here is boiling.
It's a pleasure to be here, and thank you so much for inviting me.
Thank you very much, and see you soon.
Bye.